Joining us now, Eric Nepute, as promised, from the Nepute Wellness Center in St. Louis, Missouri. Doctor, welcome.
Randy, thanks for having me. I appreciate it.
No problem at all. We've talked a little bit about why you're on and what you do, but could you go over a little bit what your wellness center does?
Well, Randy, I'll tell you here, it's better for me to tell you what we don't do. I
Okay.
mean, people ask me this all the time. What do you guys do? I said, well, here's what we don't do. We don't do surgery. We don't deliver babies. And people say, what do you mean by that? I said, well, years ago, we created this system out of pure frustration. I mean, I was frustrated because, patients are frustrated as well because they have to go all over the place to see so many different specialists and so many, for different problems. And I said, you know what, we got to create a one-stop shop for all things. So we have facilities now. We actually have 13 of them across the country that are getting ready to open up. It's a one-stop shop. We've got medical doctors, we've got pain management doctors, we've got chiropractors, physical therapists, cardiologists, pediatricians, nutritionalists. I mean, really all under one roof, looking at the individual. Whenever a patient comes in, we all get a chance to look at them to find out, what's really truly the cause of their symptoms or their problems, and not just treating their symptoms with drugs and pills. So, it's a unique approach. It's very effective. We have over a 94% success rate with all of our clients that come in, and it's because we have a different view of how to look at a patient. Again, we base our care off of their physiology, not off of their feelings. So one of the phrases of our Nepute Wellness Centers is, we don't guess, we test. Physiology doesn't lie. So it's really been a blessing and a little different way to practice.
Yeah.
But I will tell you that that different way of practice has been catching traction like you wouldn't believe. We have hospital organizations and large doctors groups that are constantly asking us to come to them and teach and train them on how we do what we do, because the results speak for themselves.
Yeah, I mean, we got connected through a gentleman that's been a guest here on my podcast a couple of times, Jamie Dukes, and the whole drip fusion and Pro IV. And in talking earlier, you had mentioned you've been doing IV and vitamin and all kinds of various drip fusion type treatments for a long time.
Yeah, that's correct. I mean, we've been doing what's technically called orthomolecular medicine, which is the fancy doctor word for IV nutritional therapy. We've been doing that for well over a decade. And I mean, literally cases from chronic pain to fatigue to depression to anxiety to PTSD to, fibromyalgia, hormone imbalances, you name it, can all be helped with these type of modalities. And like I told you, the unique approach that we have is when a patient comes into our facilities, we don't just go, hey, here's an IV bag, this is what we're going to do. We want to measure their chemistry and really customize this thing for that individual person. So it's really been a blessing, and it really is a lot of fun to help people, especially my demographic of people. We're kind of the last stop before the bus stop with most folks, and people have been there, tried many things. A lot of times people come to us addicted on opioids, and we're able to get them off those addictions and help them fix the underlying cause that really created the problem in the first place. So it's great.
Hey, tell me a little bit, because I've read some about it, but you did a study through the VA on chronic pain. How did that go, and what exactly did that study tell you?
Yeah, that's a great question. So the study that you're referring to is one that we did a couple years back on the use of, actually 2 years, it's about a year and a half ago, on the use of IV nutritional therapy with one of our IV formulas called the Pro IV and chronic pain. And we had the VA locally here in St. Louis had identified 100 of their veterans who had chronic pain being someone that's had pain more than 3 months. And we put them through a study. And this study, basically, we would have them come in and do a weekly IV for 4 weeks. And then we would have them come and do an IV every 2 weeks after that. We did this for 90 days with the veterans. And then we did studies on their pain. We did an SF-36 test, and then symptom surveys, and it was interesting. Whenever we had sat down to go over our findings, every one of our patients, and I mean every one of them, out of 100 people showed a reduction in symptomatology without increasing any of their own prescription opioids, which is a huge breakthrough. And what was wild about the study, not only did everyone show positive results, but what was crazy was there were hardly any negative results. And that's one of the big things when you're checking out a potential drug or a solution is, well, what's the side effect, right? I mean, that's kind of the big deal. And when you talk to the FDA, they want to make sure that the risk doesn't outweigh the benefit. And so when we sat down and we looked at all the side effects, here's a list of some of the side effects we would have. Improved mood, improved color of skin, body function has felt better now than it has in years, depression has gone away, pain has gone away. I mean, the only times that we had anybody that had any what we call adverse reactions were folks that had blood sugar problems like diabetes, weren't eating their foods properly, didn't have a snack before they got an IV, and their blood sugars dropped down on them. That's because things like vitamin C naturally lower blood sugars. So when people were taking things to lower their blood sugars, and then we gave them some natural vitamin C and IV, and it lowered it even further, long-term effects are we're able to help get them off their drugs because this helped them with their blood sugar. So it was really kind of an exciting thing to see that there was a massive positive result. And what was even more exciting to see was little to no side effects whatsoever, which, you look at every drug commercial on TV, and the last 30 seconds of every drug commercial is every possible symptom you can have. And we don't have those kind of adverse reactions. So that's pretty awesome, Randy.
Yeah, I tell you what, I'm all for it. We happen to live here in this area is probably I think the number 3 area when it comes to this opioid epidemic that's happened to our communities all over the country. And, our youth is being challenged by this, and there's got to be ways out there because obviously what we're doing now isn't working. So there's got to be alternatives to this that can really help these kids.
Randy, here's the deal is, I hate to say this, but, knowledge changes over time, right? And when we as physicians were told by the pharmaceutical companies that, hey, listen, these opioids, they're not addictive, they're not harmful, they're not going to cause these adverse reactions. Listen, we were lied to, and that's all there is to it. And we didn't know any better. So, we prescribed these to our patients because that's what we thought was the best thing to do for us. That's what our best practice protocol said. Well, now the shifting has really happened towards moving away from pain and symptom management towards finding the cause of the problem. What's the physiological effect that's really truly making the pain happen in the first place, and not just blocking the pain, but going after the true cause. And that's really a big awakening and a big shift in healthcare. And I'm just fortunate that we're a huge part of that. So it's a lot of fun. And like you said, we're all for it as well.
How did you get involved or come about the whole happening with Pro IV and Jamie and all of them?
Well, here's what I'll tell you. How I got into IV nutritional therapy by itself was kind of an interesting story. I standard practice in medicine and had a great practice in St. Louis. And my wife got really ill. And long story short, we couldn't find out what's going on with her. And I had met with a physician who had been doing IV vitamin C therapy for 25 years. And he said, she just needs some IVs of vitamins. And I thought he was crazy because I didn't know that much about nutrition at the time. Yeah. Like most of my colleagues were just not trained on it. And once he gave her second IV in 2 days, she was like a new person. And I thought, oh my gosh, I've got to study this. So I devoted the rest of my career at that point to studying orthomolecular nutrition and how it affects, the physiology of the body and how we can biohack the body by giving these micro and macronutrients to the system. And so I've been doing that on a big level. And I've always worked with NFL and professional athletes. I've always worked with the Rams when they were in St. Louis and still work with them in LA. And have had high level athletes kind of always seek us out because of our uniqueness of what we do. And, we're kind of like Kevin Bacon. I'm like 2 degrees of separation from everybody in the healthcare world. So Jamie Dukes and I got a connection through a mutual friend. We sat down, hit it off. I loved his mission of what he was trying to accomplish of finding a non-opioid, non-addictive solution to chronic pain. And when I said, hey, we were already doing something like this, it was just a match made in heaven. And the rest is history. And we're just now collecting more data and doing more work with, the NFL and the VA and a lot of other professional organizations out there to collect as much data as we can to show the benefits of this stuff, because, we don't have 5 years to wait to see all these studies to come out. People need to know now that there are options and alternatives to opioids so that they don't have all these horrible problems. I mean, 60,000+ people died last year from opioids, just opioids.
Well, just out of curiosity, how many years did the FDA study all these drugs that are now the problem before they approved them?
That's the thing, and that's the thing people don't realize is a lot of times it's a 3 to 6 year process before a drug by the time it gets manufactured to the time it gets launched to the public, and then they continue studies until indefinitely on them. I mean, here's the thing: we've known, and the studies have shown, and the information, quite honestly, was suppressed to us as physicians. We knew that opioids were addictive, and we knew that there were some horrible side effects of them. We just didn't know how bad they were. And now we do, and now it's a nightmare. I mean, the new laws and regulations have really helped patients not get access to opioids, at least legally. The problem is that people don't know what else to do, so now they're buying fentanyl and opioids off the streets because they can't get them from their legal drug dealer, their doctors anymore. So we've got to bring awareness to the community. You see, doctor is Latin for teacher. Doctors are supposed to teach and educate the community on what's possible, what options are out there. And that's what we're doing with the Pro-IV approach and really what's called the wellness revolution that's really out now, helping people understand that they can get better by treating their physiology and not treating their symptoms.
All right. Hey, doctors, thank you so much. I'm a little smarter for it, and hopefully the folks listening are too, and really appreciate you joining me.
Thanks, Randy. You guys have a great day. I'm always happy to help.
Thank you so much.